After performing local traction to L5 S1 to try and restore mobility in that segment adjacent to a pain-generating L4-5 segment, we now are going to want to perform a gliding technique in the direction of pain provocation so that the segments around the painful hypermobile segment will move more effectively and reduce the load on the pain-generating segment. In this case, the patient has pain with extension. So we're going to mobilize L5 S1 first in the direction of extension so that when she extends, it takes the load off the pain-generating segment. First, we have to preposition the pain-generating hypermobile segment and segments above in a position of flexion so that the mobilization technique does not create pain in that segment. Secondly, we will be ultimately using a side bending to treat her right L5 S1 in the direction of extension. In this case, we'll be shifting her sky side pelvis to move S1 in a direction of extension on L5. Therefore, the segments above, we will side bend in the opposite direction. Here we're using a right side bending to treat the right side L5 S1, L4-5 and up, we will left side bend here. And in a flexed position with left side bending, we will rotate the cranial segments down through L4-5, in this case, in a flexed position with left side bending in the direction of right rotation. Now, in the segment we're treating, we will place that segment in a small amount of extension. We will be using a right side bending for the mobilization. And as far as rotation is concerned, we're going to allow that segment to rotate in the direction that it naturally goes, because with clinical testing of this particular patient, we're not certain how that segment's going to couple in its movement.